Glamour fearless. This is Mr. Divabetic in Philadelphia with the leader of the Divabetic Club, Philadelphia, Neva White.
Hi, Max.
Hi, Neva. We've been talking to divas now for several months, and one of the big issues that comes up is there's a lot of confusion around the symptoms of having a high and low blood sugar. And of course, several divas don't want to check, they want to trust their instincts, which could present a problem.
Well, we always want to be proactive, so monitoring your blood sugar is important to self-management. And sometimes you can be confused with high and low blood sugar if you just trust your feelings. So
is that because there's a similarity between these symptoms of high and low?
There are some similarities. There are some feelings that go for being high and low. You might be irritable, shaky, sweating. Sometimes you can feel both of those symptoms, whether your blood sugar is high or low. Usually when your blood sugar is high, you may feel very thirsty. You may find yourself urinating because you're drinking, and blurred vision. Those are the symptoms that tend to stand out with a high blood sugar. You can also, when your blood sugar is low, a lot of times the person feels very hungry. They may be a little disoriented. They may be confused. And again, these are things that we can't necessarily trust just the way we feel. It's important that we monitor our blood sugar because this is something that needs to be treated. It is an emergency when your blood sugar drops down too low.
All right, so if you are having a low, though, we always talk about the rule of 15.
Rule of 15, and that is where you want to make sure that you're getting 15 grams of carbohydrate, and then once you do that, and that could be some juice, that could be eating pieces of candy. The best thing is glucose tablets.
I thought you were going to say
emergency
cheesecake.
Glucose. That's the best thing.
And it's not a big gulp. It's like, if
Not
you're going to do
a
the
big
juice, it's just like a quarter cup.
Yeah, about 4 ounces
Because the
of
risk
juice.
here is like if you over-treat, then
Exactly.
you pull the number so far up that you have to now treat a high blood sugar. So the idea of doing the rule of 15 is to slowly gradually take it up, wait 15 minutes after they have quarter cup of orange juice, a few glucose tabs, and see where that number is so that they're not doing a roller coaster for the next couple hours.
Exactly.
And if they have a high blood sugar,
If you have a high blood sugar, now that's something you can discuss with your physician. Some patients, if they're on insulin, they're instructed to treat themselves. If not, you can talk with your doctor, talk with your provider about when you should call and what you should do given the goals and where you are in your range for your blood sugar. So that's really something that you have to determine with your provider.
and this is why it's so important for people to find a meter that they really like that fits into their lifestyle. We had a whole program on Check Yourself Before You Wreck Yourself because your meter really needs to be your best friend. So if you're having a hard time using it, you can't read the numbers on it, it's too expensive, you need to find something that you can travel with every day.
Yes, and it's important that people understand what is a low blood sugar and what is a high blood sugar and when you need to take action. And it's important to understand that before you have to actually take action. Tell your family, alert your family, let your family be part of your self-management.
And come on down to the Divabetic Club. It's a free hour meeting every month here at the Thomas Jefferson University Hospital. We would love to meet you.